All right, well, for expectant mothers, COVID-19 is bringing on a lot of concerns and a lot of questions. Rachel Sanchi joins us this morning. And Rachel, you are 35 weeks pregnant right now?
35 weeks right now. So the countdown is definitely on, but it's also just such an interesting time right now being pregnant and about to give birth with all this COVID-19 stuff going on, and things are changing daily. With the virus continuing to spread and research continuing to come in, hospitals are tweaking their policies and procedures. And so as of right now, what we know is that no one except the patient is allowed for appointments. You do have to be screened before you even get through the building. So every time I go in for an appointment, they take my temperature, ask me questions, give me a mask. Then for delivery, only one support person is allowed, no visitors. Plus, 2 hospitals in New York, they recently implemented COVID-19 testing for all pregnant women admitted for delivery. So the big question, if mom tests positive for COVID-19, how could it impact the baby?
At this point in time, the research does not show that it is passed on through the placenta to the baby. Probably the most likely time when a baby would be COVID-19 positive would be after delivery if mom was COVID-19 positive and was breastfeeding and didn't use appropriate face mask or hand hygiene.
Dr. Bruner said that there are a small number of cases where baby has tested positive for COVID-19, and it was likely passed on through the breastfeeding interaction. She also said that the research right now, of course, it's limited, and that mom does test positive. It's really all dealt with on a case-by-case basis. Now, for those 2 hospitals in New York that are testing patients right now, we know that of the 215 women tested, 33 of them tested positive, and almost all of them didn't have any symptoms. So, and you know, Donna, I mean, 3 times over, you know this, that a lot of those symptoms are the same symptoms through pregnancy with tiredness, aches and pains, shortness of breath. So really, especially for pregnant women, you need to practice social distancing and be sure to wash your hands constantly.
Yeah. And especially the closer you get to delivery day, which you are approaching. So, Rachel, yeah, I frustrated for you and all the pregnant women having to go through such a joyful time right now, but with such scary stuff out there. So,
right.
Yeah. All right. We'll talk to you later. Rachel, thank you.